My name is Chanel and I'm doing my presentation on hoarding and health. Hoarding is persistent difficulty discarding or parting with possessions regardless of their actual value. The behavior usually has deleterious effects: emotional, physical, social, financial, and even legal. For hoarders, these things can affect themselves as well as their family members. Hoarding is different than collecting. An example of hoarding is seen in the picture above. It is a collection of everything and anything that a person feels they're going to get value off of, they have an emotional attachment to, they come across a good bargain, different things like that, and it's usually kept in their homes and viewed as trash by others, but by them, they do have sentimental value and attachment to these items. Collecting is different because you collect certain items, and collectors usually keep their items very clean and organized. They're proud to show them off, whereas hoarders are very embarrassed of their homes. They usually don't let people into their homes. They say that their home just isn't ready, but they do feel comfortable within their stuff. There is a part of them that knows that it's a problem, but they don't really seek help for it. It's usually family members and friends that push them into getting help. Why do people hoard? As I had mentioned, some people believe that items are useful or they're going to have value in the future. They have sentimental value, or they come across good bargains they can't pass up. They also have emotional attachment to items. I'm going to show a video of a hoarder, and you'll see in the video how he's very attached to the different things that are within his home. He gets a lot of anxiety and emotional distress when the cleanup crew comes out, and he eventually does shut down the cleanup process. So I will go ahead and start that video.
Ken is struggling with a crippling addiction.
I don't talk much about how bad the hoarding is. I just say the house is not in good shape. So this is my living room. It didn't always look this way.
I'm the first and possibly only girlfriend that has ever gone into that house. My first inclination, I wanted to run.
Once a week, Lauren makes a 2-hour trip to visit her boyfriend. But recently, there's been a growing tension between them.
I don't think he's aware that his hoarding has put limits on our relationship. You gotta do something about this house. I love you so much, and you're so important to me. But this is a big problem. I've repeatedly said to him, if you don't work on your issues, I don't know how much longer I could continue to be patient.
Today, in an effort to salvage what little is left of his relationship, Ken is accepting the help of behavior therapist Dr. Natasha Santos.
Dr. Santos, nice to meet you.
Yes, sure.
When I first walked in the home, I noticed that there was very little space to move in. It was really quite alarming to see that this is how he lived. And so what room was this? Was this a living room?
The living room.
When was the last time it was functional, that it was used as a living room?
Well, I was using that couch until maybe about 8 years ago.
Okay.
This is the kitchen.
So do you prepare food in the kitchen?
I prepare food here. Yes, I do.
How do you prepare food? Where exactly?
I sometimes make over here or
On top of the toaster.
or on the, yeah.
So why don't you tell me, Lauren, how has the hoarding affected your relationship with Ken?
It's just a turnoff. I mean, it's that whole house. It's not conducive to human life.
So you don't feel comfortable coming here is what I'm hearing.
I don't.
You don't. Good morning, everyone. Thank you so much for being here today.
The team will be led by professional organizer Kay Wilkins and behavior therapist Dr. Natasha Santos.
And really excited to start the day and help you make as much progress as we possibly can. Go team! The guys over there are just newspapers and expired food.
What is this, a joke?
One of the items that Ken had a hard time discarding was a chair that his girlfriend put in the dumpster. And I think really at the core of it, he really felt like his boundaries were being pushed.
We're not doing this now!
It's been 6 weeks since Ken shut down a cleanup effort at his house. Since then, Ken's girlfriend, Lauren, has not been inside until today.
My hope is to see a lot of work done over the past 6 weeks. Oh, you can see the couch and the coffee table. Oh, you got the stairs straightened up. I can walk. Oh my God. Oh my God. What's
Here's
gonna
the
happen?
problem. Some of what was downstairs came up here. That was the problem. Because of the
Okay.
clothes.
I enjoy being with Ken. I love him with all my heart. But the condition that this house still is in is making me wonder whether we can have a future.
I hope she could feel that it's a step in the right direction. Not only I'm working on the house, I'm also working on our relationship. This is just the beginning. It's not going to stop with this.
So as you can see, he had a lot of emotional attachment to different things in his home. And these are things that we wouldn't feel are sentimental or have different value. A lot of the stuff in his house was a lot of trash. And I'm sure once he was going through the things, he didn't even know that he had those different items. But to him, it did cause a lot of emotional distress to kind of clean all of that stuff out and get rid of it. Hoarding is associated with obsessive compulsive disorder, attention deficit hyperactivity disorder, and depression. As you can see in the video alone, it caused a lot of emotional distress. So it's not surprising that these different mental disorders are comorbid with hoarding. I did look at 2 different studies. The first study was titled Medical Conditions in Geriatric Hoarding Disorder Patients, and the second was Age of Onset and Progression of Hoarding Symptoms in Older Adults. The first study measured 75 people with a hoarding disorder and 75 people that were normal or didn't have the hoarding disorder. And the participants who had the hoarding disorder showed significantly more health conditions. They reported more head injuries, arthritis, diabetes, seizures, lung conditions, and sleep apnea. But what was interesting is that they also showed to use health services less than typical adults. So it was interesting that they had more problems with health conditions but went to the doctor less frequently. The second study measured when you can kind of see the symptoms of hoarding. The median age was reported to start seeing symptoms, the first onset of symptoms, between the ages of 10 and 20 years old. The median age of onset of actually being progressed with hoarding disorder was between 20 and 30 years old, but most people weren't diagnosed until after 40 years old. So you can definitely see the long-term impacts that hoarding can have starting at age 10 and not even being diagnosed until you're over 40 years old. You can only imagine all of the stuff you could accumulate within that time frame. There are different risks that were also associated with hoarding. As you can see in a lot of the pictures here, these are not livable conditions. It's very hard to walk through. Many people don't even know what's in their house. The kitchens I found in a lot of the research I did were the worst areas. There was dirty dishes, no room on the counters. There was some videos where the lady said she hadn't opened her refrigerator for 15 years, so who even knows what was in there? So this causes a lot of problems for public health officials, firefighters especially. These houses are not under fire control. It's very hard to get out. If a fire were to light up, it's hard for firefighters to get in. You don't know if there's flammable items that are hidden underneath all of the junk, not to mention how all of that junk can catch on fire and really become a risk. There are falling hazards. They contain poor sanitary conditions, and people with hoarding disorders have higher rates of disabilities. So, different things to think about when you're thinking about hoarding. If you did have a family member who had a hoarding disorder, how do you think that would make you feel, and how would you help them throughout this time? Do you have any objects that are important to you that would cause stress and anxiety if you had to throw them away or if they were taken from you? Although a lot of the objects that are seen in the homes of hoarders seem like trash, these objects are still really important to them, so getting rid of them causes a lot of emotional distress and anxiety. So just think of something that's really important to you and how you would feel if you had to give that away or throw it away, and kind of associate that to people that have these hoarding disorders. I was surprised in the research how hoarders visited the physicians less than non-hoarders. Why do you think this could be? And that does sum up my presentation. These are my references, and thank you for listening.